Good morning, everyone, and welcome. I'm Sarah Cott, SVP of Programming at The Hill. Thank you for joining us in person this morning, and thank you to everyone joining us online for our event, Dialing into Mental Health, 1 year of the 988 Suicide and Crisis Lifeline. I'd like to thank our sponsors, the National Alliance on Mental Illness, for their support of this discussion. Today, we will be joined by lawmakers, mental health experts, and advocates to mark the milestone anniversary of the 988 Suicide and Crisis Lifeline and discuss what still needs to be done to ensure everyone can access the help they need. One program note: Republican Congressman Chris Stewart will not be joining us due to a last-minute scheduling conflict. Before we get underway, a few housekeeping notes. If you are with us in the room, please keep your phones on silent for the duration of the program. But we do encourage you to join the conversation on social media. You can follow us on Facebook, Twitter, Instagram at The Hill Events, and we will be using the hashtag #TheHillMentalHealth. And with that, I am delighted to kick off our program. Joining us virtually is Xavier Becerra, Secretary of the Department of Health and Human Services. Bob Cusack, the Hill's editor-in-chief, spoke to him yesterday.
Mr. Secretary, thanks for joining us.
Bob, thank you.
I want to talk about mental health, but I do want to get some news of the day, news of the week, and it pertains to COVID, which obviously factors into the mental health debate and question and solutions. But Energy and Commerce Republicans this week are claiming that HHS broke the law by not reappointing certain officials at NIH, including Dr. Fauci. They say that move was unconstitutional. I want to give you a chance to respond to that. I imagine you don't agree with that perspective.
We continue to do the work we must to protect the American people. We do it following the law, and we do it with the greatest professionals, including Dr. Fauci, to make sure that we protect the health of all Americans, including those who might suffer from COVID. And so, if I can say, Bob, one last thing, please get vaccinated as we prepare for the fall flu and virus season.
But as far as the reappointment, you think you're on solid legal ground there?
We continue to do the work just as any other administration has, making sure that professionals that are committed to working as part of the federal government do their work and do that under the law.
The pandemic is over, Mr. Secretary, but I just had a family member who's contracted it. Where are we and where are we going on COVID-19?
Well, COVID is with us. And Bob, you're again stating the obvious fact that COVID is with us. We know how to tackle it, manage it much better than we did 3 years ago, but it's still with us and it still can be deadly. It's still killing some Americans, far fewer than ever before, but it's still killing. And so that's why we have to stay prepared, just as you have to be prepared for any onset of the flu, especially if you are immunocompromised. And please don't fail to recognize that COVID's still out there. Protect yourself. The best way to protect yourself is with the latest version of the vaccine.
Let's go to the first year of 988, which is, I think, a fantastic idea. Everyone has been affected by mental health, either personally or they know a family member. Let's assess the first year. What has worked and what more needs to be done?
Yeah, and Bob, I think we really do have to put this in context. 9 in 10 Americans, when you ask them, will tell you that America's facing mental health crisis. Every 11 minutes, we lose someone in our families from suicide. And so this is critical. And what we're trying to do is tackle it in 2 ways. One, grow the workforce because we know we don't have enough mental health professionals today. But 2, it's give people the equitable access they need to mental health. You break your kid breaks his arm, you know, you're going to go to the hospital, they'll get it bandaged up, put a cast on it, and the arm will heal slowly. But if you're hurting, mental health, depression, it's unclear whether or not you're going to actually access a mental health professional. Those things have to change. One of the first things that the president wanted us to do is make sure people had early access. And so that's why he invested so heavily in 988, the new suicide and crisis lifeline that makes it possible for Americans who are hurting, who are about to go the wrong way in that fork in the road, to say, I'm going to call 988, like 911 for emergencies, 988 for mental health crisis is now there for you.
And that is a great thing, because the other number was very forgettable. Regarding, though, the awareness of it, the percentages of how many people, I believe it's around 13%, know of 988. So what has to be done there?
Yeah, well, just this. What we're doing today is
Right.
helping communicate to people what 988 is. Remember, 911 didn't start off with instant success either. It takes a while. There has been a Lifeline number for many decades. It's just that who can remember the 10-digit number? And depending on what region of the country you're in, you had to dial a particular number. Now it's simple. Across the country, 988. And more our state partners, who really are the ones who on the ground operate most of the 988 centers, are coming up. They're picking up the slack. They're becoming more committed to devoting resources to 988. But until then, the fact that President Biden has put in close to $1 billion in his time in office for 988, compared to the previous year before he became president, when only $23 million were devoted to 988. You can see that President Joe Biden is going to make sure that people can get their mental health care crisis addressed.
Mental health, of course, Mr. Secretary, was something that was a major problem and dilemma. And as you say, 9 out of 10 people think we're in a mental health crisis in this country. Let's talk about COVID-19 and the effect of it on mental health. On one hand, I think more people are talking, and we've done a number of events that touched upon mental health during the pandemic. More people are willing to talk about it. I think there's less of a stigma, but at the same time, it really did not help a lot of people, specifically children. And I know you have programs that are designed to help children.
Yeah, isolation can sometimes be deadly, and stigma can really kill. And so it's great that we're beginning to open up, that leaders throughout the country are speaking publicly. People who are role models are talking about some of their own experiences and past. And it's becoming clear to those who are hurting that they're not alone. And that's what becomes very important, is to really break down that stigma so people will open up. Because the reality is, oftentimes someone needs to just be able to connect. And then if we see that it's more severe, get them the health professional that they might need to work with. But the first thing we have to do is get people to recognize that they can open up. Second thing is to make sure that they know when they open up, someone who cares and who could be trusted will be there to help out.
You're the first Latino HHS secretary. How is mental health, has it disproportionately affected minorities? Obviously, mental health is a problem across this country, but I wanted to touch upon that.
In a way, yes, because like other circumstances involving healthcare generally, minority populations, those who are less advantaged, are always the last to get the support that they need, the help that they need. And so in minority communities, especially the Black and brown community, what you find is that mental health is less available to them than in, say, the white community. We're trying to change that. And there's also the issue of stigma, oftentimes based on cultural background, particular tendencies within a community. There's oftentimes less willingness to open up on some of these subjects. I know that when I was young, I remember I'd always hear the words "aguántate," tough it up, tough it out.
Right.
You can handle it. That was the way to deal with some of these internal crises that you might have. Today, we know that we have to really work with people. And so I think the more we reach out to people, the more we're not only going to be able to create a healthy America and a healthy economy, but we'll reach those who often get left behind.
What would you tell someone who's watching this right now, other than calling 988 if they're really in tough shape, but day to day, going through struggles? What can they do? What would you advise them?
There are places they can go. There are people they can see. It's no longer as it was maybe 20 years ago, where it was a desert when it came to finding the mental health help that you needed. 988 is really a godsend, because it may not be the solution, but it lets you touch someone who can send you on a path to where you will get the help you need. And what we're doing now is establishing, with the help of Congress, crisis care centers that are open 24/7. You know, when you're facing a mental health crisis, it's not just between the hours of 9 to 5. And so you can't afford to have a center have the closed sign in front of the door when you're suffering that crisis. And so today we've established mental health crisis centers throughout the country that are 24/7. Critical care, in some cases, mobile care. And so we're trying to go to where you are. And so the help is there. We still have to work hard to grow that workforce and the mental health care capacity. But unlike a couple of decades ago, today, if you reach out, someone will touch you.
What about stakeholders, whether that's in the business community or consumer advocates? Has HHS worked with them? What can they do to help quality of life?
That's right. And more we're going to do that because you talk to any employer, the sound mental health of their employees is critical if they're going to have success and be profitable. We understand that in schools, if your children are not ready to learn because they're suffering through crises, mental health crises, that it's tough for them to become the leaders of tomorrow. And so more and more we're reaching out because mental health is that hidden enemy that sometimes makes it possible for America to be all it can be. And so we're going to get out there and work with everyone who's interested, but certainly at HHS, our work is healthcare, so we're going to do everything we can within the healthcare sector to, as I said, grow that workforce and make sure that there are the professionals out there that people need.
You were a leader in Congress. What is Congress's role here? What would you like to see this divided Congress do?
Well, I simply will tip my hat to those members in the House and the Senate who, over the last 2 years, gave us the resources that the president asked for 988. $1 billion is quite a bit of money, especially when you compare it to the 23 million or so that had been devoted in the year before the president came into office. And so Congress had to make it possible. The president requested, fought for it. Congress gave us the $1 billion to stand up 988. We also received support from Congress to stand up these critical care centers that I tell you are 24/7. That without Congress's help would not be possible. And certainly we're going to look to Congress to help us grow the pipeline of professionals we need for mental health care.
As you know, Mr. Secretary, there was a big deal, bipartisan deal on the debt limit. Now there's dispute over kind of what those terms were, and there's growing fear of a government shutdown. Are you concerned about HHS's funding, especially with the House being run by Republicans and really targeting departments like yours?
Look, we do work that keeps people going, keeps people working, keeps people alive. We work with our states. We don't do the work directly because it's really the states that have jurisdiction over healthcare. But with our resources, like with 988, we make it possible for states to have success. The worst thing we can do is turn off that spigot that gives us the resources for our states to support the healthcare, mental health care of all their populations. What we did in saving lives under COVID, the pandemic, what we've done to expand the number of Americans who have access to health care. Today, there are more than 300 million Americans who have their own insurance to go to a doctor or a hospital. Never before in the history of the country can we say that there were more than 300 million Americans who had their own health insurance. We can't go backwards. If we see Congress begin to dismantle those investments, who's going to hurt? Well, the American people will hurt.
As far as, I know you were giving advice before, but how do you handle stress? You've got a stressful job. I watched some of your congressional testimony. It gets there's some conflict, but that's what Washington's about. How do you handle it on a day-to-day basis? I think our viewers would want to know.
Bob, I'm not sure I have the direct answer. All I can tell you is that when I go home, my wife and I have been together for decades. My 3 daughters, I think, still love me. If I have a home, that's all I need. There are a lot of folks who can't even say that, right? They have a home they can go to. When I say home, I don't mean a house. I mean the people who I love and who love me. And as tough as the job may be, there is something very comforting about being able to go home and be loved.
Last question. Can you tell us about what you've gotten as far as feedback? And I know we talked about how 911, a lot of people didn't know it. A lot of people still don't know what 988 is. And hopefully after this event, a lot more people will know. But what are the success stories? Because suicide is such a tragedy. It affects everything, especially the military. What have you gotten some good positive feedback on? Wow, this has been really helpful for me.
I had a session in Philadelphia where we were talking to families who were the victims of a violent death of a relative. And it was with children, we were talking with children, and there was this one little girl who talked about losing her older brother to gun violence. And he was her role model. And he had actually begun a nonprofit to try to help young men avoid gun violence. And you could see she was very traumatized still from the experience. But by the time we had finished that session, she had opened up enough to start talking. And we finished the session because we asked, what is different today for you as a result of having talked? And one of the thing that she said that really stays with me, she said, I think I'm going to try to take on the job that my brother had been doing to try to end gun violence through his nonprofit. She was still very young, in her early teens, but you could see that something sparked her and gave her the life to say, I'm going to continue forward. And these are all very tough situations. This is a girl who lives with a family who doesn't have many resources, has saw something very traumatic. I think if we just reach people, we help them, because most people have the power to really fuel themselves forward. We just got to let them know that. And that's what mental health support really is giving people a chance to fix themselves inside with some good professional help. That's what we want to try to do, because we know a lot of Americans are hurting, but they're also willing to reach out and trust us.
Well, thanks for sharing. That's a powerful story. Secretary Becerra, thanks for joining us. Really appreciate it. Such an important issue.
Thanks, Bob.